Okay. Good evening and welcome everyone for our English session. Thank you all the participants for your encouragement and participation. Welcome all to today's English session. Today is our 1024th day. Continuously we are conducting this Zoom session without any break. Successfully we are continuing our journey, and thank you once again, all the participants, for joining with us and encouraging us. And now today's our guest is Mukesh Musale. He's actually, if I'm giving introduction about him, means today one session is needed to introduce him. That much have to tell about him. But even though I am giving a short description, short details about him, he's a BHMS graduate and MHMC from Nasik and MD from IBAM Medical College, Calcutta, and PGDCR from UK, and is BA Psychology from YCMOU Nasik, postgraduate diploma in behavioral and clinical psychology, and president in Mirraculous Foundation, working in the field of social work. It's working with NGO, and he is a tutor for workshop in Aditya Homeopathic Hospital, Pune, and he's a motivational speaker. And he during COVID period, he worked for distributing preventive medicine in many colleges, and he's giving motivational speeches to many colleges in Maharashtra. And in his awards and achievements are also more to talk. National Samantha Fellowship Award, Best Practitioner Award, Healthcare Excellence Award, and COVID period many work, social work he had done for the society. And I'm welcoming you, Dr. Mukesh, for our session. We are so thankful for coming with us. Thank you so much. Welcome, sir.
Thank you, Dr. Anjani. First of all, hello to all respected and senior homeopaths who are attending this webinar. And thank you very much, Ifph, for inviting me again for this session. I had already given one session, and I hope my session, you liked my session. That's why you invited me. And thank you very much for inviting me again. As Dr. Sahani sir already said about yoga, so I am going to share just only one slide, and that's it for yoga. And then is it, you can visualize this? Yes, Dr. Anjani?
Yes.
Okay. First of all, I would like to start this session with a Guru Vandana with Dr. In the memories of Master Dr. Samuel Hahnemann and my Guru, Honorable Dr. Amarse Nikam sir. To start with this session, I memorize both of them and start with my session today. So today is a World International Yoga Day, 21st of June. So I will recommend to all my patients and also to doctors, as this is a Kali Yuga, so we don't have much time to go for yoga or yoga sessions. Our daily routines is very much busy. As a homeopath, as a doctors, we are also very much busy. So I would recommend this simple asanas, 8 asanas. It requires only 10 to 15 minutes per day. So you should follow Sukshma Vyam like this. This is Sukshma Vyam. It is very important for our daily routines. Second is Surya Namaskar, sun salutation. Third is this Markatasana. You can see how Markatasana is we can do. Fourth is Pavan Muktasana. Then Naukasan, you should follow these steps according to numbers, according to this order only. Then go for Om chanting, then Anulom Vilom, Bastrika Pranayam, Kapalbhati, and Brahmari. And lastly, the Shavasana. So this is the simple and very effective way of doing yoga. So I think you should take this screenshot so that you can remember. And this is for Yoga Day special. So afterwards, we will continue our today's session. So friends, today I'm going to share with you these cases: rheumatoid arthritis with ankylosing spondylitis, Duchenne muscular dystrophy, cerebral palsy with mental retardation, Down syndrome, leprosy, corrugated nails or crippled nails, infertility, dry gangrene, perforated appendix, and acute appendicitis, squamous cell carcinoma. I have 2 cases. So if time permits, we will cover all these cases one by one in a short period. So my today's topic is homeopathic approach in autoimmune disease. So autoimmune disease is today I'm going to cover one of the autoimmune disease, that is rheumatoid arthritis. So we will see what is the classification of rheumatoid arthritis, how it is classified according to medicine. So arthritis, what is arthritis? It is just an inflammation of joint. So arthritis is of 2 types, inflammatory and non-inflammatory. Inflammatory includes seropositive, seronegative, infectious, and crystal induced. And the second one is non-inflammatory. So what is seropositive rheumatoid arthritis? Where the anti-CCP or RA test is positive, we can label it as a seropositive rheumatoid arthritis. And seronegative, where we can't actually diagnose because of absence of RA test. RA test is negative or vice versa, it may be positive, but symptoms are there. So that's why it is labeled as seronegative. In seropositive, it includes rheumatoid arthritis, lupus, scleroderma, vasculitis, and Sjogren's syndrome. In seronegative, we have ankylosing spondylitis, psoriatic arthritis, reactive arthritis, and inflammatory bowel disease arthritis. So I think you all clear about this slide. This is just an information. You all are knowing this better. So again, this is systematic inflammatory arthritis. This is one of the second classification. It is divided under spondyloarthritis and rheumatoid arthritis. In spondyloarthritis, we have predominantly axial and peripheral classification, where ankylosing spondylitis and non-radiographic axial spondyloarthritis, it comes under axial, and psoriatic, reactive, and enteropathic arthritis, it comes under peripheral. So this is a short classification of arthritis. So in short, what is arthritis? It's an inflammation of joints. It includes acute monoarthritis, acute septic arthritis, polyarthralgia, and polyarthritis, and chronic inflammatory monoarthritis. And rheumatoid arthritis, it is the most common form of chronic inflammatory joint disease. It's a symmetrically destructive and deforming polyarthritis affecting small and large synovial joints with associated systemic disturbance and presence of circulating anti-globulin antibodies, that is the rheumatoid factors. So that's why rheumatoid arthritis is classified under seropositive. See, you can understand from this. This is our normal joint. This is cartilage. This is joint capsule, synovial membrane, and this is bone. But what happens in osteoarthritis? Here, bone ends rub together. That is a degenerative process starts here, and cartilage becomes thinner and thinner. You can see this cartilage is going thinner. This is very common disease after 40, after 45, especially in females after menopausal age. And what happens in rheumatoid arthritis? This is pathology of rheumatoid arthritis. Swollen and inflamed synovial membrane. So because of swelling and inflammation of synovial membrane, there is a bone erosion. You can see here, this is a bone erosion. So this is rheumatoid arthritis. When patient came to us, they are having this pathology is going underlying. So overall, if we see about 80 to 90% India and Pakistan is affected by rheumatoid arthritis. This is rheumatoid arthritis affections, the Central America, South America, and European countries. And mid-European countries are affected more than 95%. This is the latest classification of rheumatoid arthritis. And prevalence of selected autoimmune disease, according to WHO, is almost rheumatoid arthritis is very much common as compared to type 1 diabetes mellitus also. This number 860 is number of cases per 1 lakh people in all over the India, all over the world, sorry. Psoriasis affecting 380, Crohn's disease 201, type 1 diabetes 192, multiple sclerosis 58, and lupus 24. So this is a short introduction. What is going on in the world about this rheumatoid arthritis? So in short, rheumatoid arthritis, 39% means this is very major quantity that rheumatoid arthritis patients are affecting. And you can see this 9%, 6%, 5%. These are all autoimmune disease classification, and they are affecting individuals in all over the world. So seropositive inflammatory arthritis, rheumatoid arthritis, as I explained earlier. Second is lupus. This is an inflammatory disease caused when the immune system attacks its own tissues, can affect the joints, skin, kidneys, blood cells, brain, heart, and lungs. Third one is scleroderma. It's also called as CREST syndrome, a chronic autoimmune connective tissue disorder that is primarily characterized by thickening and hardening of the skin and the tissues. Vasculitis is an inflammation of the blood vessels that can cause vessel wall to thicken and narrow, cutting off vital blood supply to tissues and organs. And the fifth one is a Sjogren's syndrome, a disorder of your immune system identified by its two most common symptoms, that is a dry eyes and a dry mouth. When the patient comes to you having a multiple arthritic complaints, but specifically if he is having dry eyes and dry mouth, then you can label it as a Sjogren's syndrome. Seronegative inflammatory arthritis includes ankylosing spondylitis, which is also called as Bichet's disease, where HLA-B27 this test is positive, and inflammatory arthritis affecting the spine and the large joints. Psoriatic arthritis, a form of arthritis that affects skin conditions. Psoriasis. Reactive arthritis, also called as Reiter's syndrome, joint pain and swelling triggered by an infection in another part of the body. And last one is inflammatory bowel disease, arthritis, that is also called as Crohn's disease, and ulcerative colitis include in this, and it leads to inflammation of intestine. So I think you all clear about what is arthritis, what are the classification of arthritis, and how what is a pathology of arthritis. As a homeopath, we should know this pathology in and out to treat a person. Without investigation, without MRI, we can also diagnose, we can have a perspective, we can prognosis the case. So I'm going to share with you a rheumatoid arthritis case right now. So case as follows. A 52 years female suffering from rheumatoid arthritis, having anemia, RA test positive, titer was 1:4, test in 32 international unit per ml, and hemoglobin was 8 gram. So this is my way of case taking. Pain in big and small joints, chronic history of taking painkillers, pricking and stitching type of pain. See, I had took all the modalities, which is very important while prescribing. Aggravation, change of weather, evening aggravation 2+, sitting on knees 2+, mental stress, cloudy weather, and ambulation by warm or hot application, ambulation salt with water drinking, ambulation sleep after, and pressure application off. Swelling of joints, right side affected more than left, and right to left shift was prominent in this case. Stiffness of affected area with pitting type of edema, aggravation touch 2+, ambulation warm application 2+, generalized weakness, appetite reduced, loose motion, aggravation after eating, aggravation physical exertion, pain in back, stitching type, aggravation sitting on knees 2+, mental stress, ambulation, gentle massage, and propped up position. So past history and family history, having tonsillitis since childhood, herpes zoster 26 years before, chickenpox in childhood, right side scapular and collarbone fracture in childhood, anemia since childhood. Family history, father was RA positive, that is rheumatoid arthritis, and mother died due to diabetes and paralysis. Physical generals, she was having habit of tobacco since 40 to 45 years. Diet mixed, appetite decreased, desire sour 3+, pungent 2+, tea 2+, food aggravation sour, nose, right DNS operated in 1995, tongue tide coated, white, thick, dirty 2+, and red tip 3+. You can write it down for formation of a totality, so you can understand how my approach in this case. Gum bleeding plus skin itching with dandruff, perspiration profuse, sleep disturbed due to pain, position on right side, that is a right lateral position, dreams religious 3+, dreams of temple and hills, and water or sea, mostly sea. In gynec and ops, menstrual cycle, menarche 14 years of age, duration 28 days cycle, flow scanty, color black, obstetric history 3 daughter, 1 son, and 3 abortion, missed abortion. So this is end of the physical general. Now we will start with mind. As I started inquiring about her mind, as she was not willing to answer my question, because she said I'm tortured by these questions, because she was when she came to me, she came from different homeopaths and different allopaths. She was taking too much painkillers and steroids. So she said, now I am tired of giving repeated history to homeopathic doctors. So eventually I consulted her and I convinced her for further history. After a few minutes, she started telling about her sufferings, about her childhood, and childhood was that she was from separate family, poor financial condition, mild in nature in childhood. She was having desire for company. She's very much close to her mother. This present mental makeup, she's a BA and now housewife. She did her BA. She's very anxious about her disease and having no hope for curing her disease. Then I asked about her nature. So she replied, Doctor, I am very talkative and open-minded, but I don't want that anybody cross my words. If anybody oppose me, I will not tolerate and will react immediately with violent anger. So I became very much aggressive when I see my husband, and she started crying in front of me and cried for next 15 minutes continuously. So here we can select a rubric for our totality. So I was waiting for her word, keep quiet. And for next 15 minutes, there was a pin drop silence. She was not uttering any word, and I was also not talking to her. This was a situation. Then afterwards, anyhow, I again consoled her and took further history. So I asked her, why you became aggressive on your husband? So this question is formed on the spot. So how this is the best way, this is the best example how we can take a history. See, then she replied that my husband is having affair with my cousin sister since many days. Till now, so they are having in relation with each other. When I came to know this thing, I feel very sad and had thought to commit suicide, but I did not. Henceforth, I don't have feelings towards my husband and indirectly to my children and family also. So this is her reply. See how her mental condition is affecting because of her husband. So I asked anything else. So she said one more thing, that my husband is always insulting me in front of my family members and relatives. So I feel angry, and she's having fear of height. Hobbies, skillfully work. She's doing skillful work at her home, and she is having a reading habit. Thermally, patient is extremely chilly. So you can see this. This is in Marathi. I will explain you. I asked her, tell me about your suffering. So she said, appetite loss. She can't move. When she came to my clinic, two person had a company with her, and see the result after giving medicine. See the expression, how she is talking, and she's very normal. You can see the difference. She was talking that my all joints, big and small joints, were affected. She was suffering from frozen shoulder. She was saying that she was suffering from generalized weakness and breathlessness too. But after taking homeopathic medicine, she's became all right. This is the video. This video is in Marathi, but I can translate it for you. This is the video which explaining about the rubric. She was telling that my husband is behaving with me very politely during his need, but after when her husband lying to, he's regularly neglecting her. That's why she's saying that I feel that I am neglected by my family members, and I'm alone. I'm very much away from my family members. So case analysis as follows. I took causation or elements from mentals, anger and vexation. I took tobacco mystery. This is causation, under causation since 14 to 40 to 45 years. This is a reference from Clark's Mater Medica. It is given under that medicine. Physical generals, desires are 3+, sweet 3+, reference synthetic repertory, tongue white, thick and dirty, thirsty, skin itching, dandruff. Why I'm saying this reference? Because it is not included in our repertory. That's why I'm giving you reference. Appetite reduced, causing generalized weakness, skin itching, dandruff vesicles. This is my observation. And sleep disturbed, pain due to. So rubrics which I took in this case: elements from domination by others, that is husband, indifference or aversion to loved ones, indifference to own family members, husband, weeping disposition, weeping while narrating her symptoms, hatred feeling towards own family members, especially husband, of oversensitive or sensitive. And my understanding, the patient was not willing to answer my question. So I thought she is reluctant to answer. But when I observed carefully, I found she does not have interest and slight watery eye. So I thought there might be possibility of loss of love or affection. That's why I entered in her mind again, and I asked her, and I found the indifference feeling towards towards her uh, loved ones, indifference towards her husband and family members. So hopeless about recovery of disease, state of depression and stagnant thoughts, not willing to recover. This is the main uh, rubric which I thought it is under psychotic trend. So I took miasm psychosis. Totality, elements from domination by husband, indifference to loved ones, indifference to family, weeping disposition, aversion to husband, sensitive, cold aggravation, pain in joint, in general, aggravation kneeling, that is aggravation by sitting on knees, ambulation warm or hot ambulation, desire for sour food, thirsty, vesicular eruption with itching, sleeplessness due to pain. Miasm, soric with the dominant psychotic stage, hence psychosoric, thermally extremely chilly. And this is my repatriation chart. Here you can see the medicine. I prescribed her sepia 30. And the final remedy is a sepia 30. So why I prescribed this sepia? Because of the indifference feeling, that state of that patient. And I balanced all mental, physical, thermal, and I prescribed this sepia. And you had seen the results. And I had repeated medicine till today only for 6 to 8 times. I used to repeat dose when the first medicine exhausted and the symptoms used to repeat again. Then only I used to repeat the medicine. Unfortunately, during COVID third wave, this patient was expired. But till she was very fine with our homeopathic medicine. So what is the pathophysiological action of sepia? As it's a woman's remedy, it affects on venous circulation, especially of female pelvic organ, of portal system and digestive tract. Females dragged down by overwork, loss of vital fluids, and excess sexual indulgence, sudden prostration, with, I would like to add, having a strong stimulant for tobacco. More than 5 to 6 years, you can thought of this remedy sepia. Ill effects of anger and vexation, injury, overlifting, getting wet, boiled milk, fat and tobacco. Rheumatism, chronic cases, or obstinate remains of acute. Those acute cases which are remains obstinate for a long duration, you can think of sepia. Why not Staphylococcus aureus? Staphylococcus aureus is also having, as you are very much clear why I prescribed sepia, but during mind condition, we can think of Staphylococcus aureus. It's also chilly, weeping tendencies there, all mental and physical matching, covering miasm, also matching, but there is no indifference feeling in Staphy's aureus as marked in sepia, and Staphy is markedly indicated in reserved dysplasia, and which is not covered autoimmune disease. So Staphy is ruled out. Pulsatilla, as Dr. Fatak mentioned, Pulsatilla chili, but according to my knowledge and with reference to Dr. Nikam sir's thermal book, it's hot medicine. So I ruled out Pulsatilla. Weeping is marked, lack of love is also there, ending disposition is marked, no indifference feeling in Pulsatilla as compared to sepia, but other physical in general also covered, not covered autoimmune disease. So Pulsatilla is ruled out here. Causticum is also chili. Its action on nerves, motor and sensory nerves and involuntary disease like paralysis or dystrophies. So causticum is mostly indicated in muscular dystrophies and atrophic cases. Hopeless feeling is there, despondent, absent-mindedness, suicidal tendency marked in causticum. As in this case, she was having suicidal tendency, but she did not attempted it, and no indifference feeling in this causticum. So I rule out this causticum also. So dear friends and colleagues, so as there no mother tincture, no biochemic, no specific medicine, no higher potency, only 30 potency, and I got this result. So this is a small therapeutics for you. You can take a picture of it. We will go ahead fastly. As in acute aconite, antimtat, chamomilla, colocin, nux vomica, china, arsenic, and other drugs. And in chronic, arnica, abrotanum, calcarea carp, causticum, clematis, hiparsulf, lachesis, lycopodium pulsatilla. Almost all polycrests are there in chronic rheumatism. We can think of these medicine in acute and chronic. So this is a therapeutic action. See, rheumatism, the arnica, where local rheumatism is present. In spigelia, rheumatism of neck, especially aggravation by lying. In gelsemium, rheumatic neuralgia with action on muscles and motor nerves is observed. In calcarea floor, there is a lumbago, pain in back, lumbar region. Bryonia, muscular rheumatism and articular rheumatism is very common, which is aggravated by motion and ambulation by absolute rest. In Rustox, rheumatism, fibrous tissue involvement, aggravation exposure to weight. So in general, if that medicine is covering is aggravation or ambulation, we can take it in general and we can prescribe accordingly. Benzoic acid, arthritis deformans, and phosphorus, rheumatism with stiffness. Stiffness is 3+ and aggravation at morning. Nux vomica, rheumatism of large muscle. Apis mellifica, having acute inflammatory rheumatism. That's why it is included under acute. So Eupatorium perfoliatum, bony pain with fever, rheumatism in old ages. Natramure, chronic articular rheumatism, causticum, rheumatoid arthritis, spongia, rheumatic endocarditis. We can think of spongia, lachesis in rheumatism plus carditis, actius spicata. We can think in acute with there is a pain in left or right wrist joint. We can think of actius spicata. Lithium carb, chronic rheumatism, especially fingers. Sepia, having characteristic downward rheumatism as in Kalmi also, below hip, pressing type of pain, 3+ marked. And in sulfur, acute chronic rheumatism, ascending rheumatism in Ledampal and sulfur, both the medicine. Phytolacca, rheumatism of shoulder, McCarb and arms, syphilitic patient. Merck rheumatic arthritis pains, aggravation at night. Pulsatilla, rheumatism plus gastric symptom. If you get a gastric symptom with rheumatism, you can think of pulsatilla. Ruta, having rheumatism of right wrist plus both feet. Sticta, inflammatory articular rheumatism, and in Silesia, the chronic hereditary rheumatism with gouty symptoms. So this is a very important slide, as we very few homeopaths considering the time modality, but I consider this is very important. From noon to midnight, arsenic, murk, sulfur, thuja. The early morning, we can think of arsenic, bovista, kali, carp, naxomica, rustox, and thuja. Evening aggravation, pulsatilla, belladonna, rustox, colchicum, and colocynth. During rheumatism, this is time modality. Evening and night, aconite, arnica, pulsatilla, arsenic, bryonia, chamomilla, hiparsulf, murk, phosphorus, dulcamara, and graphitis. And before midnight, only one remedy, that is bryonia. So my references, Mater Medica, that is Clark's Mater Medica, Sholton Elements, Phatak Mater Medica, Kent Repertory, Synthetic Repertory, Complete Repertory, Phatak Repertory, Thermal Mater Medica book by Dr. Nikam sir, Manifestation of Miasm, Vital Force is Oxygen, Clinicals, Guyton, Davidson, and Hutchinson. These are all books which I used to refer while case taking. So we'll go ahead with my second case. We have time, right?
Up to 45. I mean, 10 minutes more.
10 minutes. Then we will go fastly.
Okay.
This is my second case, having RA positive with ankylosing spondylitis. I will show you the result. Patient is Chile. This is positive rheumatoid arthritis factor positive 1:4. Titer rheumatoid arthritis factor report positive, and HLA-B27 is also positive. This report is at 37/2012. Mr. Praveen Wagh, and after taking homeopathic treatment, RA test is negative, which is reconfirmed at different pathology. RA test is negative, and uric acid is also normal. So after treatment, this is another patient. He's explaining the result with homeopathy, and this result I got within 3 months. He start improving after 3 months. I prescribed him phosphorus 30. And then I have different cases also to share with you in a short. This corrugated nails or crippled nails case. Before treatment, you can see the corrugated nails here. I prescribed this patient arsenic album 30, repetition 8 times, and result within 11 days. After treatment, you can see her nails. So homeopathy is very quick, fast, reliable, and gentle. So see the video testimonial of patient. Her father is explaining about her recovery. I had one clinic at rural area where I visit every Sunday, and from there I took this case. This is a case of leprosy, Hansen's disease. You can see the lepromatous patches. You can see at one fine night, he was bitten by a rat. He couldn't understand, because in lepromatous, this leprosy patient, they are having senseless, numbness feeling is there. So after giving Sepia 30 repetition 5 times in 27 days, I got results in within 3rd day. He is improving, and 10th day, next improvement, 15th day, I got 80 to 90% improvement. At 27th day, I got this improvement. You can see this result. You can see chest, back, and leg. You can see before, after. Observe body language of patient. Observe how he's talking before treatment and after treatment. This is after 27 days result, almost a month. And this patient is explaining Herring's law of cure. You know, patients teaches us how homeopathy works. This is my experience. This is another case of infertility. Her patient, I prescribed Sapia 30, repetition 2 to 3 times, result within 1 month. She was she gone for IUI 3 times, but it didn't work. Then she came to me and I prescribed her Sapia and she got the result. You can see this single live intrauterine gestation. This is a case of a Down syndrome with mesenteric lymphadenopathy. You can see her pupils, eyelids. There was no hairs. After prescribing medicine, you can see the hairs, growth of hair, and you can see the patient. They're explaining that within 3 days, his mesenteric lymphadenopathy got cured. I have the evidence. I will show the result. I will show the result. See, it's a case of a Down syndrome. This chromosomal analysis indicates mixed karyotype with trisomy 21 pattern. In all cells analyzed, this chromosomal complement confirms Down syndrome. And this is the mesenteric lymphadenopathy at 2/23, 2026 and 8th of October. Sorry, 8th of October, no evidence of abdominal lymphadenopathy. This is the result within 3 days. So this is again a case of Duchenne muscular dystrophy. You can see the result. I took this second video after 4 years. After 4 years, this video, and before 4 years. I prescribed Causticum 30 repetition for 10 to 12 times. Results within 2.5 months. He was saying how he is improving after taking homeopathic medicine, and his uncle is explaining that he's suffering about he can't walk properly, he can't sit properly, but after taking homeopathic medicine, you can see the result here. This is a case of perforated appendix with acute appendicitis. I prescribed lycopodium, a repetition 1 hourly for 2 days, and I got result within 72 hours. We can see here dilated appendix with wall thickening, and this result suggestive of infective etiology with appendicitis. A few fine, tiny diverticuli in distal segment with descending colon, mild colonic wall thickening is also there, and perforation. The appendix is prominent, measuring 7 millimeter diameter in 5 millimeter appendiculoplates in mid appendix. And after results, there is no significant abnormality seen in this patient. This is a case of a dry gangrene where I prescribed arsenic album, repetition 4 to 5 times in 3 months. My repetition is according to my knowledge, so you can't copy it, and don't be. It is according to patient's condition, and according to patient it differs. I got results within 17 days. See the before treatment, after giving a dose of medicine, you can see here the blood flow, reappearance of a blood flow. You can see the third follow-up, this one, and in this, all gangrenous affections are marked. He was having planning for operation, but after coming to homeopathy, we saved his both hands and both legs. See the new development of a new nail here, development of new nail. the 6th and 7th follow-up. This is actual restoration of health and healing process in forearm, in legs also. So blood flow increase on the affected parts after giving this medicine. So if your medicine is perfect, you will get the result in all the surgical and irreversible cases also. This is my observation and my knowledge, according to my knowledge. I had a case of squamous cell carcinoma, CA buccal mucosa. I prescribed Nux vomica. I got result within 1 month. You can see the situation of the patient before treatment, after treatment, and I got this video is also in Marathi. He's explaining that there is no need of chemotherapy and radiotherapy, radiations during this cancerous condition. This is another case of squamous cell carcinoma.
Now,
Is it, my time is over.
Yeah, we will
Okay.
have a questionnaire. Those who want to ask question to Dr.
Yes. Okay. Just a minute. I will
think
stop sharing my screen.
it is better to present in another session because
Yeah, okay.
running through the cases
Okay,
it will be a loss for us.
Yes.
Okay, those who want to ask questions, please raise your hand and you can ask question. It was wonderful session and it is
Thank you, ma'am.
evidence based because many are asking, the homeopaths are treating the cases without any evidence. You cannot present any evidence. Your cases are or everything you recorded and kept. That is very useful for us to present to the world. Thank you so much. And
Thank you.
Many are treating and curing the cases, but they don't keep the records and evidence. That is our
My appeal to everyone that everyone should noted down their evidences. Everyone should have evidence.
Exactly.
So that homeopathy will grow.
Yeah. Thank you so much. And many you are a model for many of the homeopaths. And Ahmad Hassan, you can ask now. Unmute yourself.
Yes. Thank you, Dr. Respected Mukesh sir.
Thank you, sir.
Very meaningful presentation, especially you have classified seropositive and seronegative. So it is very worth for the prognosis and diagnosis purpose both also.
Yes.
And also you covered the Sjogren syndrome. Thank you very much. I am ex-biochemist and I work in Western Railway. So I have seen this area. I was in Bombay Central. Thank you very much, sir.
Thank you, sir.
Thank you. Now, Dr. Hariharan. Sir.
Sir, Dr. Mukesh. See.
Yes, sir.
Okay. Do you know me?
Yes, sir.
Okay, your class is fine and fantastic. See, evidence-based, very nice class. You must come again, doctor. And see, your information, your knowledge, please convey to us also. Doctor, see, one of my doubt is that, see, why we are treating such cases, suppose an acute exacerbation happens, what will you do, sir?
See, during acute exaggeration, it's my method is go for acute case taking. During acute case taking, I'll be observing the presenting the most prominent, that is the persistent and most prominent complaint in that patient, acute thermal, acute miasm, and acute thirst, and I will prescribe accordingly.
That time, your chronic medicine, you suppose you stop that medicine for the time being.
If required, if most of the time, if your medicine is perfect, then it will definitely going to affect. But many a times what happen, there might be a miasmatic blockage. We need to go for anti-miasmatic or intercurrent medicine, or we need to take acute history because of weather changes. So we need to change our medicine. So for that reason, for that period, we need to stop our previous medicine and go for the acute medicine. And when the acute acute stage getting over, you can continue with previous one.
Okay. Doctor, thank you very much. Thank you very much. Come again.
Yes, sir.
See, you please send that thermal material medica for me as soon as possible, doctor.
Yes, sir. Yes, sir.
And anyone else? Anyone want to?
See, Ajini, if there is no person to hand raise, suppose I like to see some doubts for me. Let me.
Sure, sure. Sure, sir, sure.
Okay, doctor, one of my doubt, why we are treating anti-TPO case in thyroid, hypothyroidism case, how the approach will be, sir? Can you explain? If the time is.
Sir, our approach as a homeopath is a simple. Take a case, go for differentiating common and uncommon symptoms, go for peculiar symptoms, take the whole case and prescribe accordingly. This is my way of style.
Okay.
Approach is very simple. We are not treating the disease, we are treating man in disease.
Okay, I feel so very difficult for anti-TPO cases. I feel very difficult. That is why I am asking anti-TPO cases. Since some patients are coming with the hereditary factors, hereditary
Yes.
cases, it is very difficult to treat. Say,
But if you expert in taking modalities, then it is very easy for you
okay.
to reach towards simillimum. This is my personal experience.
There is no need of any intercurrent remedy or anything else, doctor. Any miasmatic remedy, intercurrent.
We can go for miasmatic, but we in a first consultation we can't go directly to miasmatic medicine.
Okay. Okay, I know. I am understanding that. I am understanding. Okay, thank you very much, sir.
Dr. Indranil Bavadkar. You can unmute yourself and ask question.
Yeah, can you hear me?
Yes, yes.
Okay, Dr. Musale, very thankful for a very short and lucid presentation. So I congratulate for your presentation first.
Thank you, sir.
Yeah, few students are with me. They are new to these concepts, and it will be almost helpful for all attending doctors also. Can you explain the term pathophysiology, which we all consider in the case? Because I have got a little idea, but many people don't know it during case taking.
Pathophysiology of what? I'm not.
Yeah, so in the case analysis and evaluation, many
Yes.
times we consider the pathophysiology in the case.
Yes.
So can you explain this concept to all the doctors, because it is a new for all, even my students are asking me.
Yes, pathophysiology means a sphere of action of medicine, which is given in Fatak Mathematics and Class Mathematics. In
Okay.
clinicals, you can get all before when you read Fatak Mathematica under phosphorus, under sepia, it is mentioned that this remedy's action is on particular this organ or particular this system. It is a pathophysiological action of medicine.
Exactly. But during evaluation of a case, do you all the time refer the pathophysiology, or only you see on the totality?
No, I will consider the pathological character also.
Means both physiology means the thermals according to our
Yes,
nutrition.
yes, you are right, sir. Thermals.
Okay. So thanks for it. And how about Boger? Do you use Boger synoptic key for these things?
Yes,
Pathological?
I'm open to every this Boger, Bonninghausen, Clark, this Dr. Shelton concept.
Okay. And last question,
According to
how
case.
about the mentals? Which book to refer for mental symptoms of patient?
Definitely, we need to balance mental, physical, thermal, pathology, everything
Yeah.
to select a proper simile.
Yeah. Sir, question is, which book should they refer for the mental evaluation? The mental meanings, the
Yes,
synonyms.
for mental evaluation, you should go for complete mind repertory.
Okay, that you will be guiding.
Yes.
Okay, okay. Thanks for your answer. Thanks, sir.
Yes, sir.
Yeah.
Yes.
Thank you. Thank you all the participants. And now I am inviting Dr. Manoj for giving vote of thanks to Dr. Mukesh. And one of my question is, most of your prescription are 30th potency. Why?
We can take another chapter for this, and we are soon going to invite Dr. Nikam sir also, as he's practicing in 30 potency. 30 is very safe potency, what I feel. When you prescribe 30, you can go 200, 1M, 10M. But if you prescribe first time 1M or 10M, you can't come at lower potencies. So in all the pathological cases, 30 is a safe potency, which is having no aggravation. And I, during my whole 12-year practice, I didn't even entered any aggravation, which Dr. Kent has mentioned, Kent's 12 aggravation, but there is no.
In all these cases, you have not increased the potency. In the 30 itself, you got the result, right?
Yes. According to me, potency is not the matter of choice. Choice is your medicine.
Sir, why can't you trial these LM potencies?
Yes, if required, I will definitely try. When I didn't get result in after few days, then I definitely go for LM potencies.
Okay, thank you so much. And now I am inviting Dr. Manoj for giving vote of thanks to Dr. Mukesh. Dr. Manoj, please.
Yes, very nice presentation. And I think what is more remarkable is that after completing the graduation, he studied again and again, went through a lot of courses and a lot of contacts, a lot of efforts, and a lot of reflections. That did molded Dr. Mukesh to such an important person. That is most important thing. And the young talented persons who are watching this program must follow all these things. Because for the last 1,023 days, what we are witnessing is that those who have attended some courses beyond BHMS, they are more proficient, more efficient. They are more easily cruising through the topics. They are also easily comparing, easily recording, evaluating. All these things are possible because it indicates our institutions are not reached up to that level. So what you are doing, you personally are doing, it's a remarkable work. And this is not at all easy to come to treat all these cases, but you just beautifully done that. But the other thing is that the potency, the medicine, the similarity is most important, then potency, dose, and attenuation. All these things are important when you are giving the remedy, not the medicine. That is the most important thing. Anyway, wonderful presentation. Come again to the platform. On behalf of IFPH, I am expressing sincere thanks to Dr. Mukesh and all those who have participated in the program. Thank you.
And one more thing, 2-3 messages are there in the chat box. Dr. Mukesh, please go through that.
Yes.
And now I am inviting Dr. Shaila, Dr. P. Shaila for moderating Malayalam session. Dr. Shaila,